I'm Jeremy Mitchell, Group Manager for Rural Health Pro. Rural Health Pro is a website that was designed and implemented by the Rural Doctors Network. It's a national website, and the aim is to help capability and wellness of our rural health professionals. Through the work that RDN, Rural Doctors Network, have been doing for 35 years, they realised that capability was really important, and connectivity and keeping people on top of the issues of the day enabled people to actually do their work and feel better and capable of their work that they were doing in rural communities. And that's why Rural Health Pro was set up, because if they feel capable and they feel supported, they'll stay longer and work in rural areas for the betterment of all our community. We've got some fantastic awards across our geographic areas, each state, also each of the industry bodies, whether it be the doctors, nurses, allied health, Aboriginal and Torres Strait Islanders. They all have awards for their areas of expertise, but we found there was a gap within the market for a national award which actually singled out the work of health professionals in rural and remote Australia. So we thought it was important to celebrate, to acknowledge the great work being done. There's so much stories about the crisis of health in rural and remote Australia. While there is some problems, there is challenges. We also know there's some great stories, there's some great work being done, and we just need to celebrate that. We need to acknowledge that, because it helps not only those that are already out there, but it inspires, hopefully, a next generation of doctors, nurses and allied health to go rural. So these awards are about filling the gap of celebrating the whole industry, the whole professions that work in rural and remote Australia. We know that rural and remote and even regional Australia offers great opportunities, but also needs some special skills. One of the areas that we see constantly in this profession is people working in isolation and by themselves, especially in remote areas. We also know that some people have to be a jack of all trades. One day you could be working in the chemist, the next day you could be administering drugs at a clinic in a remote area or in a remote village. And the next day you could be doing first aid for someone who's been in a serious accident. So the skill sets required in regional and rural and remote Australia are very different from that what we see in metro. They're exciting though, because they give opportunities to do more things, to do more work in different areas. So it is a special skill set that you need. It's a special vocation that you have. And that's why these awards are about to celebrate those people and the work that they do. It's certainly been a tough fair few years. When you think before COVID, we had bushfires, we had floods, then COVID and the special requirements needed and the emergencies that had to be dealt with in isolation across Australia. So rural and remote health professionals have had it tough. They have had challenges. And we want to ensure that they get celebrated, because we need them. And we also know the problems that they're facing. We also know the challenges that they have. And we don't want to focus just on that. One of the campaigns that we ran during COVID was called Rural Positive. And it was about celebrating and acknowledging the work being done by our rural health professionals and companies, industry bodies, we had governors, we had politicians all getting on board saying thank you. So we see the National Rural Health Awards as an extension of that. It's about celebrating rural positive. It's about celebrating the good stories. They've had it tough, floods, drought, COVID. We now have issues around the economic situation, cost of living pressures that communities are feeling right across the country. And at the end of the day, that all impacts on health. And so these are the people at that front line, and they need to be acknowledged. So there are 10 categories, and we've kept them wide because we know that the diverse groupings of rural health is actually very, very wide. So we've got 10 categories which we hope to capture everyone that we can. Starting off, we have the Rising Star, which is obviously for those that are just coming into the health profession. We have excellence in Aboriginal and Torres Strait Islander healthcare. We have dedication to health in a remote location, again acknowledging the differential between working in remote areas of Australia. Excellence in rural remote health administration, another acknowledgement that health administrators play such an important role in our actual health professions and the delivery of health services. So we wanted to make sure that they were acknowledged. Rural and Remote Health Innovator of the Year, Rural and Remote Aged and Disability Carer of the Year, Rural and Remote Health Advocate of the Year, and again highlighting the importance of advocacy and the importance of pushing policy in this area. Rural and Remote Multidisciplinary Collaboration of the Year. This is one that is particularly important to the Rural Health Commissioner, who keeps talking and rightly talking about the importance of multidisciplinary collaboration. The Health Employer of the Year, and also then the final award is the Health Professional of the Year. So there are 10 categories, and we encourage everyone to nominate themselves or an organisation or an individual that they think actually needs to be celebrated, needs to be acknowledged. It's not hard to do, it's not a lengthy process. We've kept it as simple as possible, and so we hope that everyone gets out and nominates. Nominations are now open, and they are open until the 31st of August. So we encourage people to go out and get online, and the links are below. And then Parliament House, Canberra, on the 13th of November this year, we'll have a celebratory awards dinner. The Rural Health Commissioner is coming, the Assistant Minister for Rural and Regional Australia Health is going to be there as well. So it's going to be a fantastic evening of celebration. And to have it at Parliament House makes it even more special. And again, acknowledging the fact that this is a national set of awards. And so we look forward to receiving many nominations. And again, you've got until the 31st of August to nominate. And a very simple process, just follow the links below. But we hope people do nominate, celebrate, because our rural health professionals deserve it.